You're listening to Edwin Eisendrath's It's the Democracy, Stupid on WCPT 820.
All right, everybody. Thank you for sticking with me through that, bit of a rant at the beginning, but I mean every word of it. Anyway, let's turn to something equally cheery. I actually have a fabulous guest, Elizabeth Jacobs. She's been here before. She is epidemiologist and a professor emerita at the University of Arizona. She's a founding member, really the energy behind Defend Public Health. We last talked, I want to say September. It was right when Bobby Kennedy had fired the director of the CDC. Elizabeth, thank you for joining me again.
Thank you so much for having me again, Edwin.
So I want to talk about vaccines. I want to talk about the new food guidelines. I want to talk about resurgent measles. And we can start wherever you want.
Okay, well, we could actually start with a news story that just came out from South Carolina, where they have just reported 99 new measles cases over the past 3 days. And so this is a very serious issue we are facing. At the same time, the Pan American Health Organization is looking at the United States to consider whether we will keep our measles elimination status or not. And RFK Jr. is up to his old antics now, where he actually wants to try to build a case for why the United States should not lose its measles elimination status. And to do that, they're sort of tweaking a technicality about continued transmission of measles in the United States. So it's another example of his interest in optics only and not in the reality. He's doing nothing to stop this measles outbreak, but yet he also doesn't want to lose our elimination status.
What does it mean to lose our elimination status? Are there any consequences for that? Does it affect global travel? I mean, what does it mean?
What it basically is an indication of the health of a country. It's a metric that we use to provide information to the public about, whether a country's health system is functioning properly or not. So there usually aren't any type of, tangible consequences to that other than acknowledging and making public that we have completely screwed up.
So this technicality you're talking about, they want to say the measles outbreak in, say, California isn't the same one as in Texas. It's something completely different. Is that right?
Yeah, that's exactly right. And so this argument is hinging on Utah, actually. And that's interesting because in October, there was a news story out in a number of outlets that explained that the very first case in Utah refused to speak to the health department. So, In fact, we don't know where that person contracted measles, and they're trying to use that to say, oh, it probably wasn't continuous transmission.
Well, I mean, so what? Look, they may be able to pull that off in this case, but South Carolina is going to be North Carolina and Ohio before you know it.
Correct.
And I mean, the country is sicker because of these people.
Yes.
Are there any other infectious diseases that are rearing their head because of them?
Sure. Whooping cough. We've had a really bad year for whooping cough as well. And it is a cyclical disease. So there are years where we will see a really huge number of cases, and then years where there's just less, and it kind of follows this natural cycle. But again, taken together, there is no question that vaccination coverage is falling in the United States, and clearly these outbreaks are due to falling vaccination rates.
Yeah. Crazy, right? Crazy stuff.
Yeah.
And now we've cut the vaccine schedule for children in the country. And he said, wait, I wrote this down. we're aligning the U.S. childhood vaccine schedule with international consensus while strengthening transparency and informed consent. Really?
This is nonsense. We are actually now going to be lagging behind a number of European countries. They really like to compare us to Denmark, and that's another longer story. But if you actually look at the vaccination recommendations across Europe, we are now lagging behind them, first of all. And second of all, the vaccines that are no longer recommended, these are hepatitis A, hepatitis B, rotavirus, meningococcal disease, flu, and COVID. These particular vaccines have prevented nearly 2 million hospitalizations and more than 90,000 deaths since they were released. So, to say that this has any basis in science is absolutely ridiculous. And in fact, they couldn't. So that's why they're using this ridiculous, justification that we're now in line with Europe. It's kind of funny that the Trump administration is against globalism and all of that until it comes to this particular issue.
Wait a minute. They're saying we should be like Denmark, a nation that we are also saying we think is irresponsible, and we're going to take Greenland from them.
Exactly.
So we're taking Greenland and their vaccination schedule.
Yes, exactly, but not their nationalized health care, of course.
Not their nationalized health care,
right.
and not their. I mean, they have all kinds of reasons why that a vaccination schedule that's appropriate for Denmark isn't appropriate for the U.S. I mean, the size of the country, the lack of diversity of the country, the national health care of the country, the overall better health practices in that country. There are all kinds of reasons why they don't create the I don't know what you call them, the disease reservoirs that we create.
That's right. That's completely right. And discussing Greenland briefly, I wanted to say that Greenland separated its public health system from Denmark in the early 1990s because Denmark was, without women's consent, actually sterilizing and against women's knowledge, providing contraception. They were actually inserting IUDs into women without telling them that. So
really,
Greenland, yes, Greenland said, "We are out. We are out. We're not going to work." And so they're, interestingly, their health system is separate from Denmark's.
All right. So we are going to. I mean, the hospitalization numbers that you say these vaccines have prevented. What was that number again? Was it very big?
2 million hospitalizations and 90,000 deaths.
Yeah, I mean, just take the hospitalizations for a second. 2 million hospitalizations is an enormous expense. I mean, leaving aside what it feels like to be so sick you have to be in the hospital, for the country, it's enormously costly.
It absolutely is. And there's also, as you sort of mentioned there, some serious trauma associated with being hospitalized, especially for children. It's really quite scary. Mm-hmm. And that can live with kids for a really long time. They can have medical trauma that sticks with them. It could be something as quote unquote minor as being terrified of shots, or it could be much more serious. So, yeah, this is not trivial. The other piece to this is, and this is more related to measles, but if your child is unvaccinated and there is an outbreak in your area, the local public health department has the authority to order you to quarantine or isolate. And so that means for parents, missed work to stay home with the child, and it could be up to 3 weeks per go around. So a lot of people, we should focus on health first and foremost, but a lot of people don't fully understand that the vaccination program also helps keep our country running.
I'm afraid, Elizabeth, that a quarantine program could no longer be implemented in America. I think if public health told people in, some states that, hey, look, for the good of everybody, and it's the law, you're infected with a highly infectious disease, you have to quarantine, they would say, it's my free right to go wherever I want in this country, and you can't tell me not to, and they'll go infect everybody.
Well, sure, and some of them are. In South Carolina, they have had a little bit of pushback, but they also do have, I think, 200 people in either quarantine or isolation right now. But that said, you're exactly right. We saw this with COVID-19 where
Hmm.
individuals, I don't want to get vaccinated. So we would say, well, could you wear a mask? No, I don't want to do that either. Do you want to stay home? No, I don't want to do that either. And, to circle back,
It's just so
the,
selfish.
yeah,
It's
it's
so
just,
selfish.
we've lost this sense of community that we used to have, this dedication to our neighbors to help them be healthy and to keep ourselves healthy. We've just lost that. And in fact, RFK Jr. just this morning released a video on Twitter where he's railing against Germany for prosecuting doctors that violated public health law during the pandemic. And RFK Jr. actually says doctors are acting for the collective. And that's what and he's angry about it. That's what public health is. It's acting for the collective.
Well, so let me push back, go back, and then I'll get there. But I want to back up a little bit. I do not believe we have lost this. I think there is a partisan minority in America that has lost it and does not care about each other or the country for some crazy partisan reason. But as we're seeing all over the country, we saw it in Chicago, heaven knows we're seeing it in Minneapolis, people are coming out of their houses in order to protect their neighbors because we care about our neighbors. When you look at what, and now I'm talking about in response to the ICE raids, but I think this instinct that we are one community and we should look out for each other has not been lost, no matter what the right wing in America tells us, and for whatever reason, sick reasons they have of their own to do it.
Well, that's absolutely a very fair point, Edwin, and you're absolutely right. I will rescind my comment that we've lost it. I will amend it and say that our leadership has lost it.
Yes.
or they never had it to begin with.
Right, and they profit somehow, both politically and sometimes economically, by dividing us and by selling the clicks that go with these conspiracy theories.
Certainly. They certainly do.
Yeah. I mean, it's just hideous. And anyway, your second point about Bobby Kennedy going after the German government for saying we need to take care of our whole people. This is in line, of course, with the entire administration's effort to support AfD, the fascist party in Germany, and to claim that anything that looks out after the public good is communist, and that's why we need the fascists back. That's why they say, well, free speech for, I guess, every fascist in Europe, where we've aligned with the fascist. This administration in our country is aligned with fascist parties in Europe, and Kennedy's outburst this morning, Kennedy's outbreak is what I think about everywhere else, is in line with that.
Absolutely. And it really is all tied together where there's this, eugenicist mindset where it's every person for themselves. And he had a comment the other day where he kind of slipped up and said something like only sick children should die of measles, for example. So this belief that you have some kind of innate strength, if you will, that's going to protect you from viruses is absolutely ridiculous. And at the same time, people with resources, with wealth and privilege will be able to continue to get vaccines if they want. It's, again, the vulnerable people of the United States that are going to be harmed by this the most at first. Eventually, if this is allowed to continue, it's going to take all of us down.
Yeah. All right. Well, either that or heart disease. So let's let's move and talk about like the food guidelines. I was just thrilled to know that I should just be eating cheeseburgers again all day long. I haven't done that since I was a young man.
Right on. That sounds really good. No sugar though. Yeah,
Yeah.
so we can't have pie, but yeah, so I, the whole thing is so childish that they released this pyramid and they're like, well, we flipped the food guide pyramid upside down. First of all, the food guide pyramid was sort of retired in 2005, really, and we developed some other guidance after that. But he's sort of tilting at windmills again and fighting something that really doesn't exist. The scientific report that came out last year about this time was really quite similar to guidance that we've had in the past, where you want to keep your saturated fat at less than 10% of your diet. But then Kennedy, says, well, you should be eating more red meat and butter and beef tallow. So these recommendations are clearly contradictory just on their face.
But like, why is he doing it? I mean, I don't know if there's no reason to get in his head, but in order to do it, he had to get rid of a bunch of scientists.
Sure. Yes, he did. And of course, he has this report at his fingertips too from scientists, which he's simply chosen to ignore. So why is he doing it? That's the burning question. I can't answer that. He can profit from undermining vaccines, and I guess he can profit from this in some ways as well. But it's just continuing to back up this overall mindset that you can do whatever you want, and you shouldn't listen to experts because they're trying to control you or whatever.
Okay, well, great. He is leading the what's supposed to be the government agency of experts. So I mean, he might as well just leave and shut the door behind him. We won't be any worse off. You have your organization, which I like, Defend Public Health, has this fabulous website, and on it you have what you call like the Whopper of the Week, and some of it is just so much fun. And if you're listening, everybody, you should go on Defend Public Health's website and look at these. Like, for example, one that I pulled the other day because I didn't even know this was a thing. They're claiming that antidepressants are the cause for mass shootings.
Yes. Yes.
That's right. That's crazy.
It is. And it just goes back to not understanding the basic principles of how a study is done. People who are depressed are the people who are on antidepressants. And they often are not, I wouldn't even want to say often. Sometimes when somebody is gripped by depression, that can manifest itself in
Terrible
violence
ways.
against themselves or against somebody else. But to go back and say it's because of the antidepressants is completely contra to how you would do a scientific analysis. So it's a confounding factor that they don't care about. And this just goes back to Kennedy's overall desire to have a simple explanation for every complicated reality. So if he can blame antidepressants, then he doesn't have to address the very severe mental health challenges that we have in this country.
I mean, his view about medicine is don't take it. This about vaccines is don't take it. His view about guidance about what you should eat and not eat is don't pay attention. I mean, I think he just like live happy, do whatever you want, and if you die a couple of years earlier, you know what, you've been happy, right? That's not good counsel.
No, it's not. And he also ignores the fact that he himself is still alive because of his wealth and privilege. He's not communicating from a position that even applies to the vast majority of Americans. And he doesn't seem to see it. And that does seem to be completely contrary to what his father seemed to believe and understand, that there are people in the United States who are marginalized and not seen, and that we need to do our best to create policies to elevate everybody. His son has turned into the exact opposite of that type of philosophy.
Yeah, no, Bobby. This Bobby is really dangerous for the country.
He
Dangerous
is.
for the country.
He is.
And
Yeah.
he also, I mean, he also lied to Congress, but I guess that is a requirement if you want to serve in this administration.
It certainly is, and that brings us to Bill Cassidy.
Yeah, I
If we
want to
want to
talk
talk
about him.
about him
I
for a
do.
second.
Absolutely. You right there on my list. Yep.
So yeah, Bill Cassidy, the senator from Louisiana, he's an MD, and he likes to brag about how he ran vaccination campaigns for underprivileged kids, but he has completely abandoned his duty to as a doctor. He writes these tweets about how angry he is about what RFK Jr. is doing. The man is a US senator. None of us has the power to do what Cassidy could do, which would be to convince the House to impeach Kennedy and then to convince his colleagues to convict him and get rid of him, because Cassidy is up for election. And so he is trying to get that sweet, sweet MAGA vote. So he won't do a darn thing
So
to stop Kennedy.
yeah, I mean, before you came on, I spoke a little bit about today's Republican Party, Elizabeth, and I just think they are a criminal fascist party. They want to hold power at all costs for their party, and that matters to them more than our health, more than our democracy, more than our laws. And this man that you're talking about is a great example, right? He knows better. He's an MD. He knows about vaccines. He said so in a hearing, but he won't do a thing about it. He would rather let everyone get sick than risk anything for the country.
That's absolutely true. And I completely agree with you about the state of the current Republican Party. And we can, of course, see that with these ICE raids and these detentions, including of American citizens that have been happening. And of course, the
Detentions and murder of American
right,
citizens. Yeah.
the murder of not just Renee Good, but other individuals, people of color who've been murdered. And they're these things that we're seeing also have public health impact, because it's causing terror, trauma amongst all of us, and that's
Mm-hmm.
the goal, of course.
Let me ask you about the medical profession. Um, um, it's, as far as I know, the doctors have not, as a group, really been into politics. I mean, the AMA does some lobbying, but by and large, doctors have steered away from like leave the politics to the politicians, and but now politics, in the form of MAGA conspiracies turned government policies, is undermining the core of the medical profession, which is like evidence-based medicine, right?
That's right.
And still, they're largely on the sidelines. Like, what's it going to take for doctors en masse to say, you know what, we're closing the hospital. That we will take we're gonna go on a general strike until this government cares about its people.
So I think about this problem a lot, Edwin. And so, doctors or healthcare professionals are a really diverse group of people. But I would say that most of them are in this role because they are the types of people who absolutely could not tolerate walking out because they know that
Mm-hmm.
people would die, right? And so Trump, the regime also knows this. So I just think that doctors would really struggle, nurses to leave patients to walk out. So I don't know how
Well,
you
maybe
do
something
that.
less dramatic they could
Yeah,
do.
yeah, yeah. But to your point about doctors and scientists, I can just speak to my own training where,
Hmm.
learning, going through graduate school, we were in no uncertain terms by our employers, universities, told that we cannot speak about political issues in public. That is a fundamental part of training, at least when I was coming up.
Hmm.
I don't know if that's changing now, but it's really hard to get past that. I've been in meetings with some people who have been fired from the CDC and other organizations, and they say, it's really hard for me to start doing advocacy because it's contrary to how I've had to operate for the past decades. And I said, absolutely me too. When I retired, well, first during the pandemic, I would say I became radicalized. And if, to be radical leftist scum, I guess. But it became clear to me that my own silence was complicity. And I think we need to reach a stage where people in my field in medicine really start to understand that.
I agree, and I don't know how to get them there. I mean, we have the attack on vaccines, we have the attack on nutrition, we have the dismantling of what we do for public health in the country, and we've also had an attack on nursing as a profession, in the sense that this government will not now help pay for student loans for nurses the way they do for other professions, because I think they think it's a profession for women, and so they want women not to be in professions. I don't know, but all of this impacts the health of individuals and the public health and the public and the national economy and our productivity. And our status in the world. I mean, all of it. And the folks in that profession, their voices are missing, and it's a sadness for me.
It is. And you know what? They also did that to public health degrees. The
Hmm.
same thing they did to nursing
Yes,
degrees.
same
But
thing with public health degrees.
I
Yep.
mean, to your point, if we look at public health, or if we just look at the vaccination program in the US and we imagine it as a house, there are some load bearing walls. And one of those load bearing walls is exactly what you just said. We need nursing, healthcare professionals, and public health personnel. We also need research to be funded. We need the government to provide accurate information, and we need CDC vaccine recommendations. So those are load bearing walls. And so while we might not see an immediate effect of these attacks, all of those load bearing walls are being subjected to cannon shots from RFK Jr. and the Trump regime, including from Trump himself, who's wandered into the medical field, I guess, with his, don't
Don't
take
take
Tylenol
Tylenol. Yeah, right.
and
Jinx.
separate out the MMR. It's like,
Yeah.
dude, honestly, just shut up. Like he knows nothing about this area. So anyway, the house will collapse. If he keeps it up, the house is going to collapse. And I think that's what RFK Jr. ultimately wants to see happen.
Sickening. All right, I wanted to spend time with you on this today, but now I have to ask this question: how does America pay attention to this when the rest of the news every day is, I don't know, we are murdering people on boats when they're clinging to the side of the boats,
Right.
and the U.S. government is doing that, or they're shooting Americans on the streets, or they are or they are taking people off the streets and they're dying in ICE custody, God knows where, or we're invading a foreign country, or we're threatening to blow up NATO by taking land from one of our NATO allies. How is it in that environment Americans are supposed to pay attention to public health?
Well, that's very, very hard. And when Trump was first elected, I think I posted something about how each of us is going to be quickly overwhelmed if we don't identify our lane and then sort of stick to it. And because it is overwhelming. And so while I sometimes will be, posting or doing advocacy in areas around ICE, for example, mostly I try to focus on my area of expertise, which is public health. And so I think it's important for everybody to decide which of these things they are going to work on attacking and make that their main focus. Otherwise it is just too overwhelming. And I literally have to walk away from the news for days, just to sort of recover if I don't maintain my focus. So I don't think that all of us can do all of those things. I don't even know if any of us can do all of those things. So I think if we all focus on one piece, there's enough of us to elicit change.
I guess let me ask that question a different way. If we are all focused on different pieces, will we have the power that we to force change, or should we decide collectively, this opposition, that there are 3 or 4 pieces we should all focus on and get more wood behind a few arrowheads?
So I think either of those things is viable. My thinking is just all of us pulling at our edge of the problem is leading us directly back to the same thing, which is that Republicans all need to be voted out of office, period. So whether you're coming at it from murders by federal agents, from the destruction of public health, or whatever, we're all going to end up in the same place, which is we have got to get rid of Republican leadership. It is a failure. Republicans cannot govern.
They can govern. They just can't govern well. They're definitely governing.
This is true.
Yeah. I think, are you in Arizona?
Yes.
So you are about to export one of yours to the middle of the country. Carrie Lake is thinking that she is going to run for Senate in the lovely farm state of Iowa. Do you have any wisdom or any warning for the good people of Iowa?
Oh, my friends in Iowa. Actually, one of my best friends is in Iowa. So, yeah, I think Carrie Lake is a vacuous, useless fool, and she is power mad, ambition mad. She is not sincere in anything that she says. And just to let Iowans know, you've got to get out after her immediately. Mark Kelly, thank goodness, was able to defeat her, but she came pretty close. And so I would tell you as well that Carrie Lake is actually worse than Donald Trump. So if you want to give up your current awful governor and replace her with Carrie Lake, whatever you're experiencing now is going to get 1,000 times worse.
Yeah, I heard she was thinking of running for Senate, not governor, but either way.
Oh, sorry, Senate. Yeah.
Well, good. Thank you for that warning. I appreciate it. I mean, you're where you live has been the site of some of the real battlegrounds in this fight. Election denial work, fighting to keep elections. I mean, and the whole country sort of saw it there.
Yeah, TPUSA is headquartered here. Steve Bannon has a house here. There's definitely a very vibrant MAGA group that's active in Arizona. And the other piece is that we're starting to hear that ICE is going to make Arizona its next target. So you had mentioned, how we can focus on different things. And one of the things that I will be focusing on is being out in the streets if ICE is here, documenting what they are doing. Mm-hmm. So we are a purple state, but we have definitely enclaves where there are certain political entrenched systems. And where I live in Tucson, we are certainly not, as a rule, welcoming of ICE or of kidnapping our neighbors. So I'm sort of holding my breath and just getting ready for what I'm going to need to do.
Yeah, I mean, there's a through line in this, and this goes back to the conversation we had earlier, the public part of public health. There is like, okay, I can take care of myself, but there are things that we do to make us all healthier. And we've been talking about vaccines and the CDC's work when there's an outbreak and research and the hospital medical infrastructure to support care. But I suppose we should also talk about water systems and sewer systems, which were some of the most powerful public health improvements in the history of mankind. These are things we do together because we care about each other, because a rich guy can make a well and have a septic field wherever he wants. But we did these things so that we could all be healthier, so that cholera epidemics stopped happening. Um, and this extends past physical health into societal health when you start looking out for your neighbors when some fascist thugs come in and start pointing their guns at citizens and saying we're going to take somebody out of a daycare center because we can.
Absolutely. And if I could take the water thing for a second and run with that, it ties back into these nutritional guidelines that were released because if you notice that at the top of the weird upside down pyramid, you see red meat and dairy, and these are two struggling industries in the United States right now. So how does this circle back to water? Because dairy is not environmentally sustainable, and so Chris Mays, our Attorney General in Arizona, has just forced a dairy or dairy farms to pay the state for them taking more water out of the groundwater than they were ever said that they were going to and that they
Mm-hmm.
promised not to. So all of this just circles back into public health, into community care. Of course, Doug Ducey, our former Republican governor, had struck a deal with Saudi Arabia to they could grow alfalfa in Arizona and again use up a lot of the water. And then they'd ship it all the way back to Saudi Arabia to feed their cattle. And that's just unbelievable to me. So,
Really
yes,
globally responsible behavior. Just buy the cattle from Montana and call it a day. You can ship the meat to Saudi.
right, right. And I mean, the costs involved in that and shipping alfalfa all the way to Saudi Arabia tells you how much of a smoking deal Ducey must have given them to use our water.
Yeah,
Because
I mean,
otherwise, that's just not possible.
I mean that just this is way off topic, but the Saudis have a real food security issue. They live in a place that doesn't have enough water for the population they have, and they constantly worry about what's our food security strategy? How are we going to know we have a food supply at all times? But then that is a question we all have to ask ourselves because in our country, our food strategy is a global one. And these tariffs I mean, I was at the grocery store this morning. Oh man, these tariffs have interrupted the global food supply, and food prices are way up,
Yes,
way
yes,
up.
they are. And I mean, again, it kind of circles back. I wrote an op-ed that actually wasn't published around this time last year where I was sort of sending up a warning flare that our food safety and security was going to take a hit. I am by far not the only person who was on to this topic at that time. But yeah, we could see very early on that the combination of deportations and then, of course, now abuse, murder, and kidnap of Hispanic individuals, combined with firing federal workers, mass firings, was going to result in slippage and erosion of our food safety program, which we are now seeing. And of course, food supply limitations, and then combine that with the cuts to SNAP and other food assistance programs. The funding to food banks was cut. It really gives you a hideous picture of what we are facing going into 2026. at the start of the
Yeah,
year, I
look,
should say. Yeah.
Elizabeth, I so appreciate I know your expertise is public health and the absolute disaster that RFK has been for America and for the health of America. And I really appreciate your going on this walk with me where we connect that to the bigger picture of the attack on America's America's health and safety and security and prosperity more broadly.
Thank you for giving me the opportunity because, yes, it's all of these things just point back to one thing. We have got to vote Republicans out of office. We have to.
Well, we're going to try, and we're going to, and you know, Americans are getting organized. I mean, I'm very proud of what I've seen Americans do. It's very hard when you're faced with the biggest propaganda machine in history, spouting lies every moment of every day. When the traditional media that you've trusted gets bought by friends of the guy in charge, and like CBS News now lies. It's very, very hard for people to, you know, take the time to figure out what's right and then to act. But Americans in increasing numbers have made up their mind that this administration and its supporters are bad for the country.
Absolutely. And I have to say that if I could pick one problem out of everything towards facing our democracy, you've exactly just said it. It's disinformation, it's rampant, it's propaganda, it's coming from the US government. We live in different information environments, and I don't know how we get past that.
Well, let's get past the next election first.
Yes.
And then we'll at least have a
Yes.
chance. Hey,
Absolutely.
I really appreciate your spending time with me, and tell people how they can find your work.
Sure. Thanks for having me again. And Defend Public Health is pretty easy to find. We're just www.defendpublichealth.org. And I really appreciate you mentioning the Whopper of the Week, Edwin, because that's a great team that puts that up. We actually, our biggest challenge with that is usually to choose which of the insane things RFK Jr. has done on any given week to talk about. So I hope people can come to our website and maybe join some of our state organizing teams that we have going now.
Talk about those for 1 second. We have a couple minutes. That would be actually really interesting.
Sure. So, John Schaefer of Defend Public Health has started an initiative to begin state based organizing, and we did get a little bit of funding to do this. I should say a generous amount of funding to do this from Robert Wood Johnson Foundation. And so we now have about 13 state teams that are really looking at the public health issues facing their state, because public health is more local than I think a lot of people may be aware. And so the idea is people are monitoring their states, and they're going to start preparing policy platforms and actions that can be taken at the state level. And we do have a number of these teams going now, but if anybody wants to get in contact, please go to the website. I will actually be the person who gets your email if you contact us, and I will put you in touch with whoever you need to be in touch with in order to join one of our state groups.
Thank you, Elizabeth. I really, really appreciate that. Good luck out there, and keep up the great work.
Thank you for your work too, Edwin. I appreciate it.